Bismillahirrahmanirrahim. So we start the next lecture regarding the nutrition, and this is the last lecture in the module of nutrition and metabolism. Yes, so when we start with the dietary carbohydrates, with the large molecules, macromolecule, carbohydrates, protein, and lipids. We start with the dietary carbohydrates. It's a primary source for energy. It provides 4 kilocalorie per grams. That is the energy produced from 1 gram of carbohydrate is a 4 kilocalorie. You can transfer kilocalorie to the joules, as you know. Carbohydrates is divided into two: simple and complex. Simple monosaccharides, disaccharides, and complex as the polysaccharides. Polysaccharides also can be varied with heteropolysaccharides or common polysaccharides. Monosaccharides, examples like glucose, fructose, and galactose, while the disaccharide like maltose and lactose and sucrose. Polysaccharides is the starch, fibers, and glycogen, and cellulose is in the plant. Carbohydrate classification of the food divided, as I told you, the monosaccharides. This is example for monosaccharides: glucose, abundant in fruit, sweet corn, syrups, and honey. And this is glucose is abundant generally in the fruit, while fructose is found together with the glucose as in honey and fruits. Sucrose, as you know, is divided disaccharides. Sucrose is a disaccharide, or we call it table sugar. Generally, we use it. The table sugar, this consists of glucose and fructose. It's found generally in abundant molasses and maple syrups, like cane sugar, سكر المالتو سكر البنجر ولا هذا قصب السكر. Lactose, as you know, it's compound of glucose and galactose, is mainly found in the milk. Maltose, enzymatic digestion of carbohydrate starches. For example, when they digest it, granules they come as maltose. Two sugar, glucose and glucose. The term sugar refers as a monosaccharide and disaccharide. Generally, when we say sugars, we call it monosaccharide and disaccharide both. And we know that monosaccharide, disaccharide is sweet, while, for example, polysaccharides is not sweet. Polysaccharides, mainly we talk about the starch and we talk about the glycogen. And polymer do not have a sweet taste. Starch is an example of complex carbohydrates that found in the plant, while glycogen is storage form of carbohydrate in animal. Common source of starch, including the wheat and grain, potato, dried beans, and vegetable, is a common with starch. Starch is a polysaccharide that is abundant in plant origin. The first type is the fibers. Dietary fibers is defined as non-digestible carbohydrate present intact in plant, like cellulose, for example. Sometimes it's non-digestible. Resistant to the digestion and absorption in human small intestine, but completely or partially fermented in the short as a shortgen in the colons and the large intestines. If you look at it, dietary fibers divided into soluble fibers dissolve in water, and insoluble fibers do not dissolve in water. That is the example. If you look at it, grains, for example, wheat, and fruits, that is can consider as dried fruit. Dried fruit considered as sometimes as fibers. The function of the fiber: dietary fiber provide little energy, but fiber is good. Sometimes it can absorb 10 to 15 times its own weight in water. So it's rich in water. They can draw in fluid into the lumen of the intestine, increasing the bowel motility. So it's good for movement of the bowel. especially in the elderly people. They needed to take some fibers. Food source of the fiber include whole wheat, fresh or dried fruits, and vegetable. This kind of is fibers. Good example that contain fibers. Soluble fibers delay gastric emptying. That's good, and can result in sensation of the fullness. When you take some fibers, so you can use as in the regime. You can use some fibers. It's better. This delayed emptying results in the reduced risk of blood glucose following a meal. Also, it's good for diabetic patient to use the fibers. Could delay the absorption of glucose, so they become less peak of glucose after digestion and absorption. Some claim that fibers can lower cholesterol. Also, fiber-rich diets increase the risk of constipation and hemorrhoids. Is good for that. The recommended daily diet is very important: 25 grams per day, or 135 grams per day for men is better. This is recommended one. Requirement of carbohydrates. The RDA recommended dietary allowance for carbohydrate is 130 grams per day. يعني يمكن تلقى الخبز هذا الرغيفة تقريبا 70 جرامز زي 2 pieces of bread for adults and children based on the amount of glucose used by carbohydrate depending on tissues such as the brain. يعني the main important of carbohydrates that provide energy and provide glucose. Glucose is slowly used by the brain and erythrocytes. They should supplement with the glucose. Adults should consume 45 to 65% of the total calorie from carbohydrates. Yani 60% of our need of the calorie come from carbohydrates. The other come from protein and fat. Simple sugar and disease. There is no direct evidence that the consumption of the simple sugar is harmful. Yes, but sometimes sugar increase is not recommended for sugar, table sugar, the important table sugar. But in general, since you are healthy, insulin they can break down the glucose that help in the transfer of glucose. But when exhaustion of glucose, insulin, they can lead to the diabetes mellitus. That's high in sucrose do not lead to diabetes or hypoglycemia in healthy one. But in case of you have a problem with insulin, definitely or in the secretion of insulin, sensitivity of insulin, the amount of insulin secretion, they can lead to the diabetes mellitus, as I told you. And sometimes it thinks that saccharose consumption are associated with the dental caries, particularly in the absence of fluoride treatment. Because in general, the saccharose or deposit of the saccharose in the teeth, they can use by bacteria, fermenting bacteria, and they can make dental caries. Dietary proteins, the other way around, that protein is very important for our human. The quality of dietary protein is a measure of its ability to provide essential amino acid. We know there is some essential amino acid, non-essential amino acid. Non-essential amino acid, essential should be provided in the diet. About 10 amino acids should be provided in the diet to maintain the tissue maintenance. Protein from animal source like meat, poultry, milk, and fish have a high quality because it contains all the essential amino acids compared to the plant protein that is lacks some of amino acids. Because we know what we needed. We need the protein for building mainly, not for the energy, but for the building and tissue replacement, for example, is very important in the growth. Protein is very important for immune systems. Protein is very important in that cases. Protein in plant source, wheat, corn, rice, and beans have a lower quality than do animal protein. For example, if we take some countries, they use the wheat only, and they found that there's a deficiency of the lysine. Then they use just wheat. In African countries, some countries, they use only wheats, no animal proteins. Or sometimes in India, vegetarians, they use only wheat for animal plant origin. They can have some problem with the lysine deficiency, and also some methionine poor, like in the kidney beans. So we can combine both to reduce and improve biological values. Nitrogen balance. Consider with the protein breakdown. You know the breakdown of proteins, amino acids. They can have nitrogen bases and carbon skeleton. Nitrogen bases, they excreted in the transfer to urea and secreted in the urine. Nitrogen balance occurs when the amount of nitrogen consumed equal to that of nitrogen excreted. That's the balance. Consumed equal to the excreted one. They can excrete in the urine, sweat, and feces. That's just equations. They show you the protein balance equal intake minus excretion. Positive nitrogen balance. When they occur, nitrogen take exceeds the nitrogen excretion. This is observed during the situation in which tissue grows. For example, in the childhood, pregnancy, and during recovery from severe illness, you have a positive nitrogen balance. You are taking exceed that excretions. Negative in the opposite way. Round occurring the nitrogen loss greater than nitrogen intake, and this is kind of associated with inadequate dietary protein, lack of essential amino acid during physiological stress such as trauma, burns, illness, and surgery. In this case, you are in negative nitrogen balance. Our recommended dietary allowance, like in the carbohydrates, is 0.8 gram per kilogram body weight. Adults, they consume about 56 grams to the 70 kilograms individual. Not too much, like much more come from carbohydrate, less from protein. Sorry. People who exercise strenuously, they need much more proteins. So breaking down for the muscles, they need much more intake of the protein. Like the athletes, they recommended the 1 gram per kilogram. That means about 70 grams. Also, women are pregnant or lactating require up to 30 grams per day in addition to their basal requirement to support the growth infant, and should consume 2 grams per day. So you need increase in pregnancy, you need much more protein because you are building for infant growth. Consumption of excess protein. There is no physiological advantage to the consumption of more protein than RDA. We know that we cannot store the amino acid. Any excess of amino acid excreted. So no advantage for to take much more protein than needed. When excess protein is eliminated from the body as a urinary nitrogen, it is often accompanied by increased urinary calcium, and that is a drawback. More protein, more urinary nitrogen excreted, they can accompany with some calcium, so increase hypocalcemia and increase the risk of nephrocystis and osteoporosis in elderly people, in women, especially in the woman. The protein is very effective of carbohydrate, so carbohydrate is considered as the protein is bearing because it allows amino acid to be used for repair and maintenance tissue protein rather than gluconeogenesis. When you have much more carbohydrates, you can spare for protein. Proteins, they go for building rather than go for gluconeogenesis. We know that some amino acids, glycogenic amino acids, they go for gluconeogenesis to produce glucose. So the carbohydrate is very important to spare the protein. If carbohydrate intake is less than 130 grams per day, they can go protein are metabolized to provide precursor for gluconeogenesis. Decrease the protein amino acids. What is important is protein energy malnutrition, PEM. In developed country, different from developing country. In developed country, most frequently seen in patients with medical condition that decrease appetite, or alter nutrients are digested or absorbed. Hospitalized patients, trauma in this case, there is a primary protein energy malnourished BM. In developing countries, it's very important to have inadequate intake of protein. Energy is a primary cause of BM. In this case, affected show a variety of symptoms, including depressed immune systems, reduced ability to resist infection, low immunity, compromised immune systems. That means you are exposed to infection, especially in the developing country. So this is the extreme form of BM are kwashiorkor and marasmus. Kwashiorkor occurring protein deprivation is relatively greater than reduction of the total calorie. In this case, there is a deficiency of protein, and this can lead to a severe decreased sensitivity of the visceral protein, like immune systems proteins. Kwash is frequently in children after 1 year of age, when their diets consist predominantly of carbohydrates. This is in developing countries. We found the children generally there is edema because there is a plasma protein, decrease of the blood protein, and typical symptoms include stomach growth, edema, skin lesion, depigmented hair, anorexia, enlarged fatty liver. Enlarged fatty liver, and decreased plasma protein albumin lead to the edema. So edema results from the lack of adequate plasma protein to maintain the distribution of the water between blood and tissue. You see here, edema. It's very clear with the fatty livers. Compared to that one of the marasmus, the problem with the calorie itself. One calorie deviation is relatively greater than reduction of protein. It usually occurs in children younger than 1 year of age. Breast milk is supplemented with the water granules. Native cereals are usually deficient in protein and calorie. Typical symptoms include arrested growth. You see here symptoms. Extreme muscle wasting, emaciation, weakness, anemia. Factors do not show the edema or change the plasma protein observed in kwashiorkor. You see how it looks, wasting of the muscles, and this is common in developing countries. Not developing. They are not developing. They are stopped from developing. It's underdeveloped country. I think so. This is common in Africa, and India, and this. Yes, and that is, I think, so the last slide regarding the nutrition. And we end with covered all the theoretical part and the module of nutrition and metabolism. As I told you, after that you are ready to go for the exam. I don't know when will be, but in case of the announcement, you should be ready. I don't know about the practicals. Some they are claiming that they can be in Dungula,